how California communities are combating COVID-19 and vaccine misinformation panel. Harsha, what are your thoughts on this?
So as Adrian mentioned, staff education is very, very important. And right at the beginning, in the December, January, into 2021, when vaccines came in, we did see that a lot of our staff were also hesitant, and they are the first line, to talk to the patients, the medical assistant, the front desk, the community health workers that we have. So that was the thing that we dealt with in an appropriate fashion. So we also created the huddles, but also some all staff or the town hall meetings in which we brought different specialists in our clinics, infectious disease, as well as the experts to talk about the vaccines. And in the past, because these vaccines were built at a very high speed, as we all know, and this is thanks to the science and the technology. And so that was one of the major concerns for our staff who have been in the healthcare industry. Usually the vaccines take a long time and maybe the steps were not taken properly. And so we had to educate them and make sure that we share the data with all of those, our healthcare workers. And once we pass that hurdle, then as Adrian said, it's a one-on-one thing. And anybody that comes across our patients in the clinic, like I mentioned, the medical assistant. So the team approach was very, very important. It's not just the provider talking to the patient, but every touch we have. And fortunately, the healthcare's EHR, the electronic health system we use, tags the patient if they are due for the vaccines. So right from the front desk, we offer the appointment to the patient so that it's easier. And then our primary care physicians, in every 15-minute visit, we made this that, just touch base, just ask patient, let them have their autonomy. Don't put the decisions on them, but ask them, do you have any questions related to vaccine, or can I assist you answer any of the questions? So every single visit, we asked for the injection for the tetanus and vaccines, we were trying to ask for the COVID vaccines to the patients. So that was helpful. But as Geneva mentioned, we also utilize our community health workers because it's very important, again, word of the mouth and bringing the families back. So we reached out and partnered with different organizations like City of Fremont, City of Newark, Mexican Consulate in San Jose, with the firefighters in San Jose, and we tried to reach out to the people through them. We also went on different radio stations like Spanish, Telemundo, as well as Vietnamese radio station to pass on the right information to the patients through a trusted partner, through the thing that they listen to, and also the faith-based leaders like churches as well as schools, and try to give the information to the patients so they can make the informed decisions.
Thank you. Harsha, you just touched a little bit on this, but it sounds like you all used almost every available creative solution to try and reach communities in their languages where they're in their trusted spaces with their families one-on-one. I think that one-on-one piece is very interesting as well. What were the most successful of those really creative solutions, or there are other creative solutions you haven't mentioned yet? I'd love to know what you think from the perspective. Yeah, Harsha, please go ahead first.
Okay. So we tried, and some things worked, some things did not work that well. But I want to highlight again, being serving patients in a large area through 29 different clinics. We tried to do the mass scales vaccination events. So we did two different, and we have to pick the site. So initially we were like, okay, let's do it in the clinic or around the clinic, a drive-through vaccine clinic. But that did not work out because of the space issues, because of the distance from the BART station or from the public transport station. So we created two different, we did it in the clinics also, but in addition to that, we found two spots. One was on the VTA station in San Jose area, and that's the train station. That's where people can use the public transportation and come in, as well as near the BART station in the Alameda County. So that was very easy for patients, and it was a busy area. Plus, we also did a lot of pop-up events in different areas, and usually on weekends, because weekends are the time when people, they don't have to miss the work and they can come in. And so something like we did a mass event at the Grand Century Mall, and we served more than 1,200 patients in 8 hours, giving vaccines to the clients, because those are the people working in the mall, and they can come out and get the vaccination. So that was a great. We saw a great success with that. But also we did some fun events also with vaccine. We didn't want, I mean, it's been going on for a long time. We all needed a break from pandemic. So we did a fun events in the schools. We partnered with schools, and we created actually made a cutout for Steph Curry and as well as Dwayne Johnson, The Rock. And we, advertise it into the schools for the kids to come in, get the vaccines, and get the picture with Steph Curry. So something like fun for the kids. And believe it, I mean, we always created a family event. So it's not just for the pediatric population, but the kids were coming in and they were bringing their parents to come in and get the vaccines, despite the vaccination for 18 plus was open for a long time. But it's the high schoolers, they learned about the information, and we did the youth advisory committee also to help deal with the misinformation, and they were bringing their parents to come in and get the vaccine. So I think that was very successful.
Thank you.